Hello everybody. I, Dr. Sachin Kadam, Chief Technical Officer of Advancells, Noida, welcomes you in a webinar series. This webinar is on erectile dysfunction. I will be talking about erectile dysfunction, current advances, and management of the disease. Before I start the webinar, I hope everybody, all my audience, are doing good, maintaining a social distance and preventing coronavirus from spreading its wing. Let's take a pledge of winning this disease and living healthy life forever. So let's start with the webinar on erectile dysfunctions, current advances and management of the disease. So this erectile dysfunction is a condition when man consistently suffers from difficulty of getting or maintaining his erection during sexual activity. It is totally a different condition if compared with other problems which occurs during sexual intercourse like orgasm and ejaculation problem. Also, lack of sexual desire is one of the problem which is different from erectile dysfunctions. So when we are talking about erectile dysfunction, many people says it's a man's thing. About 5% of men that are of age 40 or 40 years and old have complete erectile dysfunction, and that number increases to almost 15% of men at age 70. Mild and moderate erection dysfunction affects approximately 10% of the men per decade of life. That means almost 1 in 10 men in world suffers because of erectile dysfunction. Although this number is very high, about 33% of men who suffers from erectile dysfunction seeks help and advice about their problem. So when we are talking about erectile dysfunction, it is necessary to know the different types of erection. So when we are talking about erection, there are three main types: nocturnal, refluxogenic, psychogenic or erotic. When we are talking about nocturnal, it's something like people who have erection during their sleeps. Refluxogenic, when men shows a reflection through his or his penis gets erected when there is a touch. Psychogenic or erotic, when men watches a porn or sexually active content, there then he observe the erection. So these are three different classification of erection. Now let's see the anatomy of penis. The penis has several parts. So the part of penis are base, shaft, glans and foreskin. The tissues that make up the penis includes the dorsal nerve, blood vessels, connective tissue and erectile tissue called corpus cavernosum or and corpus spongiosum. Then there is a urethra passes from the bladder to the tip of the penis. So when we see the cross section of the penis, and if we study how erection happens, generally it says that the brain is the most powerful sex organ. It is our brain that sends that radiates through our central nervous system, triggering changes in blood flow in penis that cause erection. When the blood vessels of the uh, corpora cavernosa relax and open up, blood rushes in through the cavernosal artery to fill them. The blood then gets trapped under high blood pressure, creating an erection. The blood creates pressure in corpora cavernosa, making the penis expand and creating an erection. So, how or what are the different causes of this erectile dysfunction? When we have to see the causes, the main cause is age. Just like many health issues, erectile dysfunction becomes more common or worse as we age. As age increase, chances of symptoms of erectile dysfunction increases too. Then there is a secondary cause is our lifestyle. The lifestyle that we leads, sometimes we eat unhealthy food, and just because of unhealthy habits we tend to gain weights. But did you know that the being overweight actually cause your body to turn testosterone into estrogen? This is one of the reasons scientists believe obesity and secondary lifestyle leads to problem with erectile dysfunction. Then the third most common problem is diabetes. Diabetes is an overwhelming health problem for many reasons, and unfortunately erectile dysfunction is one of them. The longer we have diabetes, maybe type 1 or type 2, the more likely that we can experience the erectile dysfunctions. Another cause of erectile dysfunction is heart disease and high cholesterol level. Erectile dysfunction actually has interesting relationship with man's heart. It's been known for a while that things like high blood pressure, high cholesterol can cause erectile dysfunction. However, recent research has actually shown that when healthy man develops erectile dysfunction, many of them end up being diagnosed with the heart disease less than 5 years or later. So if you are experiencing erectile dysfunction and have had no other health issue, you may want to see doctor to take a look at your heart. You might be able to prevent the development of heart disease. Another cause is which is a part of bad habits which we have already seen. Another habit is smoking. Smoking and other tobacco use is connected to many health problems, including erectile dysfunction. The use of tobacco decreases blood flow throughout your entire body. This includes the blood vessels in man's penis. If the blood supply is decreased, then it is become much more difficult for you to achieve or and maintain erection. Thankfully, this type of erectile dysfunction is reversible. So when you stop smoking, you will notice the erection is automatically gets improved. Another cause is medications side effect. There are a number of medications, both prescribed and otherwise over-the-counter medicine, that can contribute to cause erectile dysfunction. Some of these includes antidepressant, blood pressure medication, acid reflux medication, pain medication, and so on and so forth. There are many other medicines that can also lead to erectile dysfunction. So if you are having difficulty with erection and recently started a new medication, ask your pharmacist or doctor who prescribed you that medicine. On separate but related note, overuse of alcohol and recreational drugs can also lead to symptoms of erectile dysfunction. Another cause is our mental health and issues and performance anxiety. You have probably heard the phrase mind over matter. Well, when it comes to erectile dysfunction, your brain plays a major role in your ability to achieve and sustain an erection. If you are under mental stress or having mental health issue, your brain can have trouble creating the nerve connections and releasing the hormone responsible for causing erection. Example of these stressors or issues includes depression, anxiety, overconsumption of pornography, and even nervousness in the bedroom. These are manageable and potentially reversible with the right support and treatment. Next problem or cause is prostate inflammation and prostate cancer. It should be no surprise that unhealthy prostate can lead to erectile dysfunction. The prostate is responsible for creating one of the component of semen. While benign prostatic hyperplasia doesn't have erectile dysfunction, the medicine used to treat this disorders can lead to erectile dysfunction. On the other hand, chronic inflammation of the prostate or prostate cancer can cause painful ejaculation and difficulty achieving an erection. Be sure to talk to your doctor if you have known prostate issue and are experiencing erectile dysfunction. Next common cause is sexually transmitted infection. A common question men have is whether sexually transmitted infection can lead to erectile dysfunction. The answer is yes. Certain sexually transmitted infection like gonorrhea, untreated HIV, viral hepatitis can sometimes cause infection in prostate glands. If this does not happen, then it is possible for you to have symptoms of erectile dysfunction. Most of the time, if you treat both the prostate infection and take steps to manage sexually transmitted infection, any issue with erectile dysfunction will restore, as well as if a prostate infection is left untreated through it can cause permanent damage. So it is better to see your doctor about it sooner than later. Low cholesterol is another cause of erectile dysfunction. An estimated 1 in 4 men has lower than normal level of testosterone. Low testosterone cause all types of men's health issue, including hair loss, insomnia, low sex drive, and erectile dysfunction. The lower the level of testosterone, the more symptomatic you may have the experience. This is very easy to identify with simple blood test and can manage with the medication. Once testosterone levels are brought back to normal, most men will notice their erectile dysfunctions symptoms getting better or going altogether. While erectile dysfunction might seems overwhelming or another stressors to add to the pile, just know that there are several treatment options out there. The hardest part for most is starting the conversation with their doctors. But by working with your healthcare provider, you can find a regime that works for you and helps give you that peace of life back again. There is an answer out there for just about everyone. And this answer we will definitely look into our coming few slides. So when we are talking about erectile dysfunction, this erectile dysfunction is also classified into few categories. You can say it has been classified into few groups. The group 1 is loss of ability and desire for sexual needs. Group 2, still affected by sex and sexual desire, but penis cannot be erect when stimulated. And the third group, the penis chooses the wrong time for erection. Group 4 is the case which is penis is still erect, the desire and excitement. So these all four groups can be associated with psychogenic, neurogenic, vascular or mixed type of variations. So how do we diagnose? For many men, a physical exam and answering questionnaire, knowing medical history, are all that needs for doctor to diagnose erectile dysfunction and recommend the treatment. If you have chronic health condition or your doctor suspects that an underlying condition might be involved into erectile dysfunction, you might need further test or consultation with specialist. Test for underlying condition might include physical examination, blood urine test, ultrasound check to note the blood vessels and blood flow, psychological examination to assess depression and other such elements. Uh, Once the diagnosed, there are several ways by which erectile dysfunction can be treated. One is simple oral medications like Viagra. There are few pumps available, although the effect of these pumps is a debatable issue. But these penis pump also helps few men to achieve a erection. Surgeries and penile implants is another way by which erectile dysfunction can be treated. As I have mentioned, overweight can cause a erectile dysfunction. So regular exercise and maintaining our body's inner and outer health is most important part of the treatment. Psychological treatment, as in our last slides we have seen that erectile dysfunction can be a psychological issue too. So psychological counseling can also lead to a better treatment modality for erectile dysfunction. There are several alternate medicines used for erectile dysfunction, and these medicines could be a shockwave treatment or a stem cell therapy. So when we are talking about stem cell therapy, as we have already seen in my last few webinars, various types of stem cells. So these stem cells can be autologous or allogenic. In case of allogenic stem cells, it can be derived from human umbilical cord cord tissue. In case of autologous, these stem cells are uh, isolated from human fat cells or human bone marrow. Okay, so once we have the stem cells, we have to decide the mode of delivery for a best effect of stem cells. In most stem cell studies targeting erectile dysfunction, intracavernous injection was chosen as route of administration for the stem cells. The choice for this route of administration was based on extensive human experience with intracavernous injection of vasoactive substance, and because many preceding studies investigating penile growth factor therapy and gene therapy targeting the endothelium or smooth muscle cells had also used intracavernous injection with excellent results. Hence, even for stem cell transplant, intracavernous injection is considered to be the best route of intervention. So once these stem cells are administered, it is necessary for us to know how these stem cells actually act. What is the mechanism of these stem cells? So I'll just give you the brief in three categories how stem cells act. The, uh, uh, the first one is erectile dysfunction due to cavernous nerve injury. Okay, so the first attempt in restoring erectile dysfunction following cavernous nerve injury using stem cell was made in University of San Francisco in year 2004. And when they have administered these stem cells, what they have observed is there is a nerve regeneration, smooth muscle preservation in penis, then apoptosis, which is a suicide of the cells, is prevented, and the corpus cavernosum is maintained in its healthy state. Thus, the nerve injury is reversible, or a new nerve regeneration takes place and erectile dysfunction is found to be cured. Another one is aging. So when we are talking about aging, generally in case of aging, what happens is the corpuscle smooth muscle cells get damaged. So when you administered stem cells, they replace corporal smooth muscle cells that are lost or functionally damaged uh, in the penis during the aging process. Also, these stem cells restore the normal compliance of these corporal tissue and helps in curing erectile dysfunction. Uh, Another one is diabetes and other metabolic symptoms. In these cases, uh, the improved vascular endothelial growth factor gene, which is resulted in erectile dysfunction or responsible for erectile dysfunction, which is lost, generally is lost in diabetes, is found to be restored, and hence the erectile dysfunction in case of diabetic patient is also found to be restored. So this is somehow the stem cells in erectile dysfunction act. So some researchers have also showed that when unmodified bone marrow derived mesenchymal stem cells injected, uh, they have traced back these mesenchymal stem cells into corpus cavernosum, where immunofluorescence staining revealed that transplanted stem cells express markers specific to endothelial cells, smooth muscle cells, and also it shows the activation of alpha smooth muscle cell actin promoter, which means that these stem cells helps in regeneration of smooth muscle cells, which are present and required for erectile dysfunction, and also endothelial cells, which are the lining of blood vessels, that also found to be improved. So how we can prevent this? As we all know, prevention is better than cure. So why not act early and prevent erectile dysfunction? To prevent erectile dysfunction, exercise is the most important key. Enough sleep and getting rid of all our tensions, so that the to maintain a best psychological health is a key thing not to have erectile dysfunction. Diet, it is a most important thing. Like the healthy diet you can keep many diseases at the bay. One has to reduce or avoid bad habits like smoking, alcohol consumption, etc. So if we follow all these precautions, I'm very sure that we can definitely keep erectile dysfunction at the bay. But just in case, if somebody get this disease, it's not the time to panic or not to hide this. Remember, like you, there are many men in the world who has this disease, and erectile dysfunction is treatable disease. So just be sure, avoid it, and uh, maintain the healthy state. Well, this is all what I have to say about erectile dysfunction today. If you have any questions, please feel free to ask. And the session is open for question and answer. Thank you so much.